At CMHA, there is no wrong door, but there must continue to be a front door. We all need an advocate, a doctor, a lawyer, a financial planner, or a guide. And we all need someone to walk down the hallway to the door, to walk beside someone, and to hold the light. When we reach out for help, we need to encounter someone to lead us the right way.
24/7 Crisis Support Peel is a large program at CMHA. We're 24 hours a day, 7 days a week, and we literally never close.
Our program was created to service the opioid crisis that has been occurring in Ontario for quite some time now. I think it's been great. We've been able to service a very wide range of the Peel Dufferin area. So we service 5 regions, Rexdale, Orangeville, Caledon, and then Bramalea and Brampton.
Well, the main part of my job is to work with clients who are high users of the emergency department. So our goal is to reduce that number.
There's been a lot of challenges over the years and a lot of successes. But for 15 years, I worked with the outreach team here at CMHA. Recently, I met a single woman with her children, and she fled an abusive relationship. I did everything that I could do, and she did everything that she could do. And CAS was involved, and Victim Services was aware. And she was told, "I'm sorry, there's no door of safety for you. Try again tomorrow. Try again the next day, and the next. And maybe within 3 weeks, you'll find somewhere safe to go."
Individuals living in Mississauga that are seeking case management and don't have an Access 1 diagnosis don't get case management. The best that I can do is encourage them to move to Brampton, Caledon, Bolton, Dufferin, Rexdale, Malton, or North Etobicoke. Not everybody wants to move.
Certainly the level of acuity of the calls that we're getting, people that are actively suicidal and they may have a plan in place where they actually have acquired the means and are talking about ending their lives. So that's really difficult work to do, certainly, and to be doing that 12 hours a day, day in and day out, can be really challenging, certainly.
One of the biggest challenges within the Rapid Access Addiction Clinic are clients' ambivalence to receive treatment or the readiness of change. The second one is some of the socioeconomic barriers, such as lack of finances or insurance to receive medication, as well as lack of transportation to attend our clinic.
The vast majority of clients that come in, particularly with substance use issues, are dealing with either complex post-traumatic stress disorder or developmental trauma, which, as I'm sure you can imagine, takes a lot more than 8 sessions to work with. The amount of time that I have available, the restraints that are around that, significantly hold me back for the amount of work that I can do.
They all come with different needs, and I think working with many clients, it's to understand their needs is very hard. Another challenge I would say is the lack of community resources we have in Peel. Whether again it's finding a family doctor or a psychiatrist.
I really wish that we had psychotherapy that we could offer that's affordable or covered by OHIP. There are so many people in our community that would really, really benefit from a psychotherapist, somebody that they can connect to for a longer period of time, that can build that relationship and then slowly challenge some of the areas where they're feeling stuck.
Sometimes clients who don't have a home or a permanent place of residence, it can be very difficult to lock down a place to meet and as well as keep in touch with them as they're constantly moving, their number may change. So just the initial contact and even scheduling can be a real challenge.
The vast majority of the clientele that we're talking about, particularly with concurrent disorders, so mental health and addiction, they're not going to engage the way that you would normally engage. So not everybody's going to come walking through the door, want to sit in a clinical setting to have conversations with a counsellor or a therapist. A lot of clients tend to back away from that kind of thing.
I found that sometimes clients may feel stigmatized from receiving counselling and having to admit they're attending counselling services. So I noticed that could be a bit of a barrier dealing with client engagement.
As an intake worker, it's so disheartening and frustrating to have to turn somebody away from our front door because we don't have the right support to offer. We worry, and we've seen that connecting someone to an inappropriate support can be just as damaging as just being honest and telling them, we don't have anything that fits that need.
3 weeks, 3 weeks. I meet a single, families all the time. It's like, yeah, keep trying every day. It's going to be 3 weeks. I know that, but for somebody in that situation hearing that, it's like 3 weeks. I don't know if I can do 3 hours. Like, I'm here alone with my kids. What my role with CMHA brought to this situation was advocacy and connection with external service systems. And instead of this family desperately waiting 3 weeks to accomplish safety, together we did it in 3 days.
Individualized services are absolutely critical, particularly when you're dealing with the concurrent disorders, addiction and mental health. Trying to put everybody into the same programming, that cookie cutter kind of model doesn't work.
Some of the benefits that we've observed with clients in our program are their overall quality of life has improved when it comes to sleep, relationships with others, their ability to actually engage in addiction medicine. So a lot of these clients didn't actually know that addiction medicine was an option to help with their withdrawal or to achieve abstinence. So that's been very wonderful.
One of the biggest things that we have to work with when we're dealing with this kind of clientele is an understanding that we can't think inside the box with everybody. We've got to think outside the box when it comes to engaging. Going to meet people where they're at out in the community, starting programs with other community agencies in their agencies that they go to. We recently started, I started and piloted a walk-in counselling program with Regeneration downtown Brampton, which has been pretty successful so far. Just trying to meet this kind of clientele where they're at, rather than expecting that somebody's going to come into the clinical setting, and when they don't, we label them as being difficult clientele, and then they don't receive the services that they want.
There's everything about CMHA that really means something to me. The philosophy, the steps in recovery, it just really resonates with who I am.
I'm so grateful to be able to work at an organization that values peer and clinical work and is willing to look at our frontline staff, our passion, and how we can service the community when they tell us there's something they need that we don't have.
What I love about this job is the diverse population I work with. There's 19-year-olds I work with, and there's 80-year-olds I work. We work usually 3 to 6 months with the clients, and some of the clients, when they do reach their goals by the end of our term, it's extremely satisfying.
I love meeting people in my job. I love that I encounter people that you don't really meet in everyday life. I love that they come to me in a time in their darkest hour, and I'm able to carry light and hope for them.
While crisis work is really taxing, one of the best things about this team is that it is 24 hours a day. So when I leave the office at the end of the day, I know there's an excellent team behind me, and they're always going to be answering the calls. I don't have to worry about clients overnight or on weekends and holidays, because there's always a team available to support them.
When you get into the deeper aspects of the counselling, and you can actually see sometimes that there's a light bulb that goes off for people when you're talking to them, where there's that kind of that aha moment where they realize why they do what they do, because a lot of the work that I do revolves around trying to get people to understand that any addiction, whether it's substance or process, is just a coping mechanism for what's going on in their life.
Our team consists of 2 nurse practitioners, 4 concurrent disorder specialists. We have a consulting psychiatrist and pharmacist. So we come from many different disciplines, and we get to learn from each other.
So one of the things I love about my job, similar to what Amanda just said, is the team you work with, the other workers at CMHA. But a big thing I love is also the clients I work with. I find a lot of the time I learn as much from my clients as they may learn from me. Whether that's through different approaches, through counseling or case management, or different ways to engage them, or just even things about their lives that I can later pull in other situations with my work. I just find a lot of the stuff from the clients make me better at my job, but also a better individual.
I think the main thing to me is the philosophy that they say there is no wrong door. At CMHA, there is no wrong door, but there needs to continue to be a front door. There needs to be somebody that meets you when you reach out for help, that takes your hand and takes you to the next door and lights that way, lights that path. And that's what we do here at CMHA.